Have you ever found yourself post-transplant feeling as if you're kind of disconnected from your surroundings? Maybe you're walking around in the fog. Maybe you can't comprehend, think of certain words. In general, you're just kind of confused. If that's the case for you, then you're suffering with the same thing many of us suffer with, and that is what we call the transplant fog. We're going to be talking about that today on the Transplant Helper, so stay tuned. Hey folks, welcome to Transplant Helper today. My name is Jim Merle, and yes, today we're going to be discussing what we entitle as the transplant fog. Now, most medical doctors would suggest that this is not even a real thing, but I think the large majority of us that suffer with this supposed condition post-transplant all know it is very, very real in our lives. And it comes with a lot of different symptoms, but basically all of them surround being kind of foggy, kind of confused, not aware of all your surroundings at moments, and just generally feeling like you're out of it. And I know I live like that a lot of times, and we're going to be talking in just a few moments about some of the reasons why that may occur and some of the things you can do about it. But before we get to that, I want to tell you a little story about something that happened to me today, which I think definitely illustrates what the transplant fog is like. Now, this was about 2.5, 3 hours ago. I was driving down the road and my phone rings, so obviously I pull it out. I see it happens to be UAB Specialty Pharmacy, and that's the pharmacy I use on a regular basis connected with my transplant center. I recommend doing that, by the way. I'll have a whole program on that later, but nonetheless, I see it's UAB Specialty Pharmacy, so immediately I answer the phone and I find on the other end one of the techs named Byron. Byron's a very nice guy who I've spoken to many a times to refill my meds, and he's on the other end. He said, "Mr. Merle, I need a little bit of information from you today before I can process your medicine and ship it out." Of course, I'm willing to do that because I want my medications. I need them to be shipped. So I ask him, what does he need? He immediately goes on to tell me that he needs a 3-digit code off the back of my insurance card in order to kind of go along with a new computer system they have before he can ship my meds. So immediately I get to fumbling around my billfold. It doesn't take me but a minute and I find out, hey, I really can't find what he's looking for now. So I get over to where I can pull over, concentrate a little bit better, and I go back through my billfold and I find my insurance card. Of course, he's looking for my drug coverage insurance card, this one right here, and I start looking all over the card, and unbeknownst to me, I cannot find the 3-digit number he's talking about. So immediately I'm confused. I go back and ask him, where might I find the number? Of course, he says it's going to be on the back, kind of in the middle, right below this and that. I really can't find it, so I said, I tell you what I'll do, Byron. I'll have to call you back later. I'm driving. I really can't concentrate right now, so I'm going to give you a call here in a little while. Well, as time passes, I go about, finish my errands, get back to the house, and as the fog goes, it's probably 2.5, 3 hours. I've thought nothing else about the phone conversation when I happen to lay my wallet down. That brings it all back to my memory, and I think I need to give Byron a call. Well, right before I decided to call him, I started going back through my wallet once again. Could not find the numbers he was looking for, so I dig through my bill pack over here, check the mail that's come in, find out I have no different insurance cards other than the one that I do, and I decided the best thing for me to do in the moment was not to call Byron back at the pharmacy, but to give my insurance company a call. So that's what I do. I get the 800 number off the back, I call it up, speak to a very nice lady named Sandy at length, tell her what's going on. She says, I've never heard of such. I've never heard of a 3-digit code on the back of a card. We go back and forth for a while. I said, well, I don't know what else to ask you. This is what they say they need. I'm just trying to get my information for them. So she suggests at that point that she then call my pharmacy for me while I'm on hold and try to get down to the bottom of this. Well, I go ahead, give her the number. While she's got me on hold, I'm standing there thinking to myself, you know what, Jim, I really think you're getting scammed on this. I think someone has called you that wasn't really who you thought it was. They're trying to scam you. They're trying to rip you off. They're trying to steal your information. That's what's running through my head right now. But remember, this is really all a part of the fog. Well, she comes back on after the hold, and she said, Mr. Merle, I wanted to tell you, I talked with your pharmacist there. I spoke with Byron, and Byron said he needed the 3-digit code off the back of your debit card. Yeah, that's right, my debit card, not my insurance card like I thought, not at all what I thought. He didn't need anything from the insurance company but from my debit card. Wow, okay. So I immediately apologize to Sandy. I tell her, hey, I must be the biggest idiot you've spoken to all day. I made a fool out of myself over here at the pharmacy, so I've got to call them back, yada, yada. I thank her for her time, wish her happy holidays and such, get off the phone. And now I have to call Byron back. So I call Byron back, and when I'm waiting on someone to pick up the phone, finally it rings through, and I immediately go to telling the person on the other end of the line that I need to speak to Byron. I need to talk to him about my insurance and getting my pharmaceuticals straightened out, getting my medicine shipped and all of that. And they act confused. Well, I don't know exactly what's going on then until it clicks with me. I've not even called my pharmacy. I've called my transplant coordinator. So here we go again. Now I've got to explain to her for a little bit. I didn't explain it all, believe me, but I have to explain to her a little bit why I've called them, how I need to be talking to the pharmacy, and back and forth. Finally, I'll call Byron. Byron gets on the other end of the line. I tell him, look, I'm the biggest idiot you've talked to all day. Here's my number off the back of my debit card, that little security code, whatever. He takes it, apologizes, tries to take the blame for it, which I absolutely know is wrong. He did what he should do. I just can't think. I'm in the fog, and that's how my day went. Now, have you ever had occasions like that? Yeah, I have. As a matter of fact, while I'm sitting here doing the video, I'm having to really concentrate and really focus to try to get across what I'm saying, because I believe personally that the transplant fog is real. There is, I should say, something going on in our minds post-transplant. Not for all of us, we're all different, but for the large majority of us, especially heart transplant patients, there's something going on that's real. Now, if you go and talk to your doctor about that, they'll give you one reason and another. They'll tell you you're tired, you're dehydrated, maybe it's your medications, maybe it's a side effect. I don't know what it is. I even had one doctor, and I've seen a number of people on a Facebook group use this excuse to say, well, it's because you're on a heart bypass machine for so long and the oxygen was basically depleted in your brain. That caused some dying of brain cells. That's why you're in the fog. Look, I don't know why we're in the fog. I don't know. But I do know it's something that kind of gets aggravating at times, and maybe you're dealing with it too. Now, are there things you can do about that? Probably yes. I would say above everything, you do need to stay hydrated. Whether or not that's directly connected or not, having enough hydration in your body, enough water going through your blood cells, going to your brain, keeping it moist or whatever that is, that really does help with brain function. In the second place, I do know getting plenty of rest, which I rarely do, but getting plenty of rest, adequate rest, not just the number of hours, but getting quality rest, laying in that dark room, cool room, warm room, whatever it takes for you to get to sleep, and spending enough time, maybe 6-8 hours a night getting rest. And then don't be afraid to take a nap during the day. Sometimes we need a breather. Sometimes, even though, yes, we're very blessed, we feel so much better than we did back before transplant, sometimes we just need a little bit of extra kick in there. Of course, certainly a good diet, a diet that's, high in, got a lot of vegetables in it, a lot of proteins, that sort of thing. Of course, a few carbohydrates in there just for your body to burn. That's all a good combination. Now, if you have any answers as to why the transplant fog actually occurs, I would love to hear about them. And also, if you got a funny story kind of like this that you can share or you're willing to share, I'd like to hear about that too. So put them in the comments below. Hit me up over on my Facebook page, The Transplant Helper, over on Twitter at transplant_help. I'd love to hear from you. And until next time, stay stronger, friends.